Mr. Ward.
My lady, our next witness today is Lord Agnew.
Bible in your right hand. Repeat after me. I swear by Almighty God
I swear by Almighty God
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
and nothing but the truth.
and nothing but the truth. Thank you.
I hope we got our timings right, so you haven't been twiddling your thumbs waiting to come on.
No, thank you very much. I've been well looked after.
Please state your full name for the inquiry.
Theodore Thomas Moore Agnew.
Lord Agnew, thank you for providing to the inquiry a witness statement, inquiry 000536345. It's signed. Could you confirm, please, that it's true to the best of your knowledge and belief?
Yes.
Thank you. By way of background and your role in pandemic procurement, slightly unusually, I'm going to just raise with you a number of comments that were made of your role by somebody else, by Michael Gove. Could we have, please, on the screen, INQ 000563560, and at risk of embarrassing you, Lord Agnew, I'd like to take you to certain parts of this statement. The first is here at paragraph 9. It says this: though Lord Agnew would report to me on broad policy questions concerning commercial matters, I would in the main leave the leadership to him as junior minister for the Cabinet Office. I considered then, and still consider now, that we were lucky to have an individual of such ability, dedication and probity in that role. During his time in government, he saved the taxpayer millions of pounds, and during the pandemic, he helped save lives. Have you seen that part of Mr. Gove's evidence?
No.
All right. Well, I'll take you to two other parts and then invite you to comment, if I may. The second is at page 10 and paragraph 28, also describing your role in pandemic procurement. Lord Agnew had a vitally important role within the Cabinet Office, says Mr. Gove, especially in these early stages. Given his extensive commercial and government background, I wanted him to act as the linchpin between the Cabinet Office, the Treasury and the Department of Health and Social Care to help with all commercial elements of the pandemic, including procurement. Lord Agnew agreed to undertake this role, and I was kept abreast of developments in reports from him as and when required. Throughout those early months of the pandemic in particular, I recall Lord Agnew went to enormous efforts, together with the GCCO, to assist on many procurement issues with the Department of Health and the Treasury. And then finally, if I may...
Sorry, what's the GCC? Was that Gareth Rees-Williams?
Yes, the
right.
commercial
Yeah.
government. And then finally, at paragraph 106, ultimately, the effective discharge of public policy during any crisis such as a pandemic depends on the quality of individuals in office. I wish to thank the superb team of ministers and officials with whom I worked in the Cabinet Office, who did a particularly good job in very difficult circumstances. And I wish to thank Lord Agnew most of all. He is a hero. So that is Mr. Gove's description of your role. He added in oral evidence last week that you devoted a significant amount of your time to pandemic procurement, albeit that he was unable to put an exact percentage on it. Do those descriptions of your role ring true with you, Lord Agnew? Are they an accurate description of your...
You'll have to be the judge of that. I mean, I've never been one for self-promotion. I mean, in a way, we were lucky because I'd worked with him for nearly 10 years before this whole crisis blew up. I worked with him in the planning of the education reforms in 2009. I was on the board of the DFE when he came in as the Secretary of State. I became the chairman of the Academy's board, which was a one-man board, me, to push through some of those policies. I then went, when he got sacked by Cameron, I went off as his lead non-exec at the Ministry of Justice, which is where I met Lady Hallett, actually. Then he got sacked by May from there, and then very shortly after that, I became Education Minister in the Lords. So again, I did keep in touch with him, and then he was the one who convinced me to take on this benighted role after Boris won the election. So we know we've been through a lot over the years, but I mean, one of his strengths, and I know that he can be a divisive figure for some people, but because he has intellectual self-confidence, he's happy to accept the things he doesn't know a lot about or have particular expertise in. So he always brought around him people to complement that.
Lord Agnew, let me take you back to my question. There was a reason for asking it.
Right, sorry.
I won't be the judge of it. Our chair will. But there was a reason for asking you whether the description given by Mr. Gove of your role in pandemic procurement is one that you regard as accurate. You give your own description of your role in your own witness statement. You tell us at paragraph 2 that on the 14th of February 2020 you joined the Cabinet Office as a minister, yes?
Yeah.
And you say that by July of 2020, your focus was very substantially redirected to a new role handled by the Chancellor of the Exchequer, namely Her Majesty's HMRC's Minister for Brexit Readiness.
Yeah.
Between joining the Cabinet Office and taking on the HMRC role, you say that your involvement in COVID-related procurement was focused on ventilator procurement. And you specifically make the point that you had in your brief the designation procurement minister. So presumably that was more general than ventilator procurement. That's a general procurement role, yes?
Correct.
Albeit you say this, the reality is that it accounted for only about 5% of your workload.
Well, I was talking about my general brief as a minister, but obviously those first few weeks were utterly chaotic. And I was heavily involved in procurement, but very much around the ventilator programme, because I volunteered to be the minister that oversaw the work that was done on that. In terms of the wider things, as I said in my statement, one of the most useful things I did was get Gareth Rhys-Williams to push a lot of his good commercial people into the health department so that they could get a grip. But as you know from other statements I've made, the health department did not welcome my involvement. And so as they started to get some momentum, I was closed out of the process.
I'm going to come on to that in a few moments. What I wanted to try and establish is, or resolve, is an apparent dissonance between the description that you give of your own role and the description given of your role by Mr. Gove. Do you see a dissonance between the two or not?
Well, I think you have to look at the different timing. So, for example, if you fast forward a year or so, I was heavily involved in the new procurement bill, which was a post-Brexit piece of legislation, and that a lot of the learnings from COVID were put into the early foundations of that bill, and I was very heavily involved with that. Now, it's only just come into legislation literally, I think, a few weeks ago, but so that took up a huge amount of time. And then there was all the other procurement stuff that I did, for example, trying to get the Crown Commercial Service to be much more assertive in its provision of packages, so that we weren't seeing all this atomisation of purchasing across government, which of course included some of this COVID stuff. But I mean, if we go back to the COVID crisis on procurement, you know, the real horror stories were in those first 6 months. You know, the market across the world very quickly stabilised, but it was those early days where it really was chaotic.
Well, I'm going to come on to those 6 months now. And we're going to focus on your role within that time period and the appraisal that you give of the situation that you observed. And you give quite a lot of comment, concern, criticism even, of the way that matters were handled during that period. Is that a fair summary?
Yeah.
Can I just pick up one point before we delve into that? You served as Minister for Brexit Readiness for the 6 months preceding 1st of January 2021. Is that right?
It was probably a little bit less than that, but yeah.
Are you able to say relatively briefly whether, looking back, preparations for Brexit helped or hindered the public procurement challenge faced by the UK during the pandemic?
Do you want to just repeat
the
question? Sorry.
Whether you're able to say one way or the other, looking back, whether preparations for Brexit helped or hindered the public procurement challenge which the UK faced during the pandemic?
I mean, the problem is you were faced with two simultaneous crises, really, because the COVID obviously was the black swan. But on Brexit, as you will recall, Cameron had very proudly told civil servants not to prepare for a no vote. And then we were left in a kind of limbo, which took 3 years before Boris became the Prime Minister and drove it through. I mean, I don't know whether you're saying, whether you're leading me up to this question about the vaccines and whether we...
No, Lord Agnew, it's a neutral question. The inquiry has heard evidence in both directions.
Well, I mean, I think it was simple lack of bandwidth across government. I mean, the very fact that Gove was responsible for much of the COVID crisis and then much of the Brexit readiness implementation. So you had one minister under the most appalling pressure and strain. So I mean, I think there was one advantage of Brexit, one of COVID that helped Brexit, which now I'm just thinking aloud, really, but on the D-Day of the 1st of January 2021, we didn't have the trade flows of vehicles going through ports because there were still lockdowns going on and all that kind of stuff. So that did give us a bit of breathing space to test all of the new... I mean, we had 21 computer systems in HMRC that had to be ready on that date.
Lord Agnew, you've turned my question on its head. You found an example...
Well, I have, because I'm thinking aloud, and you're opening up all the wounds that I've spent years
let's try and keep it
forget.
focused, because we've got limited time together this afternoon.
Well, there's my answer. That on the one hand, there was lack of breadth, there was lack of management breadth in government. On the other hand, there was a tactical opportunity that did help us with Brexit in those first few weeks, because there were lower trade flows of vehicles going through our physical ports.
One of the things I heard, forgive my interrupting, in a previous module was that preparations for Brexit helped improve supply chains for COVID. Do you have any comment on that?
Well, I can't think of any examples other than, there was talk of the vaccine, which because we were leaving the EU, we had more confidence to go our own way. I think technically we always had the ability to go our own way, but somehow there was a sense that, well, actually we're leaving anyway, so let's do it ourselves. But I can't. I mean, I don't disagree with you, but I can't think of any specific examples.
Thank you.
And just to finish up on this, one of the themes in your written evidence is that a lack of preparedness created problems that resulted in to use your word, chaos during those critical months. Was any of that, in your view, lack of preparedness down to the diversion of attention onto preparations for Brexit?
No, because it should have gone back a lot further than that. I mean, we haven't had a civil contingencies infrastructure in place in this country, to my knowledge, for years, not of any scale. So, no, I think that's a red herring. I mean, it's a nice way for the Remainers to blame Brexit, but that's a total red herring.
All right, let's move on. You've got a section within your written evidence on lack of strategy, and you say in fairly robust terms there was no strategy or guidance, it was firefighting.
Correct.
Yeah.
Complete and total, which when we come to some of these notes you've asked me to have ready, I was worried about food. I mean, supermarkets were being stripped. I mean, everything was... We were naked, absolutely naked. And I think I want to stress that because, as I said to you in the ante-room, everyone has forgotten that. There's been a kind of national amnesia because, thank God it's all over, we can forget about it. But at the time, it was extremely frightening.
Well, not everyone has forgotten that, but most of those others were not in the same position as you were during these critical months. They weren't Minister for Procurement.
No.
And what I want to understand is both the situation as you found it, but also what you did, what you tried to do at the time to resolve those problems. And if you failed, as you say in fairly stark terms, you did fail, what the reasons were for that failure, because it's important that lessons should be learned. So let's just start with the lack of strategy. Is that something you attempted to introduce? Did you do your best to introduce strategy during your period of involvement? with public procurement?
It was too late. I mean, I only arrived in the department in the middle of February, and so I was confronted with a vast portfolio with the unlikely title of Minister for Efficiency and Transformation. In fact, I found the list of jobs I was given. I mean, there were 24 different roles, which I won't bore you with reading them all out to you, but I mean, the list was simply ludicrous. And so the fact that did I start busily focusing on civil contingencies as soon as I arrived in the DfE, in the Cabinet Office and Treasury? No, I don't even think I was the civil contingency minister, actually. I think there was somebody else with that role. All I do remember very clearly, which I put in my witness statement, is this Sunday morning, 2 or 3 weeks after I joined, when Gove summoned all his ministers to Whitehall. And bear in mind, I live in Norfolk. It was a 3.5-hour drive, and I wasn't happy about it. But I hadn't understood the severity of the crisis. And so I did drive from Norfolk to Whitehall for that meeting. He summoned various people, I think, including Gareth Rhys-Williams and 1 or 2 senior procurement people from the health department. And we were focusing then on this total shortage of ventilators. I remember that very clearly. And the woman from the health department was saying, well, we've got these orders from such and such a factory in Europe. They promised they'd deliver them last week. They haven't arrived. I said, well, have you ordered a lorry to go and get the damn things? You know, they were just completely rabbits in the headlights. So we were into the crisis then, and that's when I decided that where I could be most useful was where I could take hold of a specific piece of the project, which was the ventilators, because that was outside the health department. It had been announced as a Cabinet Office initiative. This was before I got involved. And so I could see that I could run that, report to Gove. It was a definable piece of work, which is why I decided to put my effort behind that.
Do you think it was the view of Mr. Gove when he decided to appoint you that it was too late in February for you to do anything about the crisis? Do you think he shared your view that you've expressed this afternoon, it being too late?
I just honestly don't know. I think, you know, the trouble is you get into a tumble dryer of events. You're just thrown literally around on a hamster wheel. And so we never had a strategic conversation about the event. Again, you have to sort of... I remember a most defining moment when they announced a lockdown in Wuhan, a city I'd never heard of, but I read in the paper it had a population of 10 million people, give or take. And I thought, this will never happen in Britain or Europe. It's an inconceivable event. You know, it was so far from our reality. Anyway, sure enough, and then the problems arose in Italy, and I remember sitting in the cabinet room with Boris and a few other people, and him saying then, he said, I'm being asked to restrict the freedoms of British citizens by more than Churchill had to at the worst stage of the Second World War. I'll never forget that. And so, I mean, I'm slightly labouring this, Mr. Wall, because it's so important that people can actually reverse their memories back into these events of these horrific few weeks and months. So I don't know that there was clever planning. And we knew there was always this problem with the health department and this ghastly quango, which they've now abolished, thank goodness. And it had a fortress mentality. And so people like me, and I'd only been there a few weeks, I wasn't, they didn't know me and vice versa. So I think it's sort of, I can't call it, there wasn't strategic thinking going on, no.
Lord Agnew, I should mention, for the sake of the stenographer, if you could try and keep your pace a little slower. I'm
sorry, but it just brings back all these nightmares of 5 years ago.
I understand
almost
that.
To the day, actually.
And for the sake of the inquiry and the topics that I was hoping to cover with you this afternoon, if you could try and keep your answers. I understand the reasons for providing the evidence up until now that you have been providing. But it will help enormously if you could try and keep your questions focused, your answers focused on the questions. Thank you. You identify a particular problem when it comes to strategy, inventory management, don't you? And in particular, you say, I don't think we need to turn to it, but we can if it helps you. At page 8 in paragraph 37, I never saw any pre-pandemic modelling, but the most egregious and easily fixed failure was a complete lack of inventory management in hospitals. And you say further they had no clue what they held in inventory at any level, or at least it took a huge effort to get access to this. And then you mention that number 10 brought in Palantir. Now, first of all, the problem of inventory management, clearly that wasn't something that you could have solved there and then because it was a pre-existing problem, correct?
Correct.
Did Palantir, a consultant, assist in any way?
Well, they were put in number 10, so they were trying to bring some sense to the whole scenario. They were trying to, I think from memory we had something, maybe the numbers are wrong, 3,000 or 4,000 ICU beds in the whole country.
Did Palantir assist in any way?
Well, exactly. So what they were trying to do was model the journey of a hospitalised patient and what percentage of those patients were escalated from a normal ward into ICU, because the horror, and again, I wasn't at first, in the front row on this, but I was in the daily meetings for a few weeks. The horror was that the standard wards would be overwhelmed, they would be pushed into ICU, and the ICU wouldn't be able to cope. Palantir were trying to track the disease, basically, and how it evolved. So, yes, I think, but I'm not really the best person on this, to be honest.
The reason I ask you the question is that you later in your statement expressed very negative views about the use of consultants more generally. Is Palantir an exception to that view?
Well, yes, it's a very different kind of beast. Palantir are data gurus with an unrivaled expertise in data mining and joining up of different systems to produce data. So what we had with the test and trace thing was a grotesque jamboree, frankly. That's a completely different issue.
At paragraph 46, you say everyone was flying blind. This is still the problems in hospitals. For example, I tried for 3 months to get oxygen capacity and consumption data for all hospitals, as this was a key determinant in how many ventilators a hospital could support. I asked for a simple spreadsheet showing oxygen delivery capacity per hospital. I never got it. Why did you fail?
Well, I must have asked 20 times.
Who did you ask?
Well, my private office were bombarding the health of the NHS England. I was speaking to the ministers over there. As I say, I can't remember his name. I think it was Edward Agar. They just didn't seem to understand why this was so important. Can I just explain why it's important? I know you don't want long answers.
If it's brief, yes.
But basically, because there were two competing types of ventilator, the CPAP and the invasive ventilator. CPAP is a much easier, quicker solution for patients. It doesn't need anaesthetists on hand. It could be deployed much quicker and cheaper. The problem is they're much more greedy on oxygen because you lose a lot through the mask, whereas the tube is going straight into your lungs. So I wanted to know what the oxygen infrastructure was. Even if we delivered hundreds of ventilators, the intubation ones, it wouldn't have been any good at all, as I've said in my statement, if they didn't have the supply of oxygen to hook them up. So the reason I gave up in the end is because ventilators subsided as one of the critical solutions. We moved on, so I didn't persevere. It was an example of the incompetence.
Well, it is useful to sort of try and look at a higher level why that apparently relatively simple request resulted in failure, essentially.
Well, it's a very good question. What I did get myself a crash course in oxygen and ventilators from a very good person who installed oxygen delivery systems to hospitals, and he, in a 20-minute little teach-in on a Saturday morning, he explained, and so all the lights came on for me. It was very quick to understand. Maybe these other people just didn't have that insight to understand why it was important. I had another issue which I was worrying about. I don't want to talk too much, but this was about diverting where you diverted ambulances to with patients who needed intubation. There's no point sending them off to a hospital that only had, say, 10 ventilators, and I wanted to see a grid of hospitals, numbers of ventilators and oxygen supporting those ventilators, a cascade of stuff. I didn't achieve anything on those lines.
All right, I want to turn to a topic that I know is of very, very considerable concern to you, spending controls. In fact, it was in relation to spending controls that you eventually resigned from government. Is that right?
Well, I mean, yes, I suppose so. It was the fraud that really got to me, but it all connects, to be honest with you.
All right. Well, let's turn to that topic now. One of your roles was Minister for Spend Controls, wasn't it?
Correct.
Yeah. What did that involve? What did it mean?
Well, when I arrived, I inherited a very demoralised team, and the first submission I got was we'd like to shut down spend controls. And given I'd been put in as Minister for Efficiency, I wasn't going to get done by that. I mean, that's a standard procedure in government. They'll hit a new minister with something that they'd like to slip past him or her quickly before they've found their feet in their new role. But I wasn't having that, so I pushed back and we kept it, and then gradually I built the morale of the team up. To give you an idea of the volume of money in the year of COVID that came across our desks, it was in excess of £140 billion.
140
billion.
Billion. So you say at your paragraph 31, I discovered that several departments had obtained exemptions from this process.
Correct.
The biggest of the Department of Health, followed by the Ministry of Defence. From memory, the value of the Department of Health exemption was a shocking 70 billion a year of spend that should have come through this scrutiny but didn't have to.
Correct.
Now, I just want to pause there before I move on to the second half of this paragraph. How does one strike the necessary balance in a crisis of the time that is necessary to scrutinise spend and the urgent need for spend in a volatile market?
Well, if I told you that one of my subs over that time was for £11 billion, which I finally got reduced to about 600 million, it gives you an idea of the sort of sloppy thinking going on around government. So
let's come back to my question.
Right,
and
well,
then
your
if you want to
question
give
is, of course, there's a natural tension, but one of the things I prided in my private office, we turn things around very, very quickly. You won't find an official who had any dealings with my private office who will say Agnew was dragging his feet, he was slow in replying to submissions. I agreed service standards. I said as long as we get X number of days, you will get dealt with. So this idea, this is a sort of lazy, sloppy talk that you get. Oh, well, we're saving the world. We can't be bothered with him. So, we're going to spend the money as we like. And you've got in the pack this one about the tests. Test £1.25 billion, and I was given a day to approve it. I mean, honestly,
I'm going to come on to that. I'm coming on to that in a moment.
Well, yeah.
The £1.25 billion and the 24-hour date for approval. But I want to just stay with this paragraph. You said, I fought hard to remove these exemptions with some success, but it took over 18 months. But the limitation of this role was that by the time submissions to spend money reached me, the horse had pretty much left the stable, and it was extremely difficult to amend decisions that the civil service machine regarded as done and dusted.
Correct.
So the 18 months, did your position last 18 months?
Yeah, I was there for just a fraction under 2 years.
And you said you had limited success within that time.
Mm-hmm.
What was the effect of that delay, that amount of delay of 18 months?
Well, I don't know, because what I didn't see, I couldn't tell you about. But we did reduce the amount of exemptions. It was derailed on the health department because just as I had finally got Hancock to agree to it, he got fired. And so we had to start all over again with the next chap. But we did achieve something. But I bet if you looked at it now, they would have slithered their way out of it, and the whatever exemptions that I managed to remove would have been reinstated, because that is how it works. If you do unpalatable things to the machine bites back ultimately.
You make specific criticisms of the experience you had in relation to spending controls in your paragraph 61 to 65. I just want to go through them quickly. Based on the outcomes, I do not think there was effective and timely coordination between daily procurement meetings and the Department of Health about procurement spending. What do you mean by that?
Well, I think that it was that they were so panicked that they just went rushing off to get whatever they could. And so there was no coordination so that I could see.
You then say the Department of Health seemed to adopt a whatever it takes approach. I've already explained what limited impact I was able to have. Now, we heard earlier in this module from Steve Barclay, who made a similar, expressed a similar concern, particularly in relation to the limited time that he and his colleagues had to scrutinise requests for spending.
Correct.
Was it your view that those requests could and should have come sooner than they did?
Absolutely.
To what do you attribute the lateness of the receipt of those requests?
Well, the two reasons. One, simple sloppiness, and second, the basic, they could just roll me over because they could pull this, it's a national emergency card, stop, get out of our way.
And how do you know it's the latter rather than...
Well, I don't know it's the latter, but I'm just working on human nature, frankly. And if you go back to Steve Barclay, who, again, for the record, is one of the most impressive ministers I ever worked with, and I was lucky to have him as the Chief Secretary when I was in my role because we dovetailed on a lot of the things. I mean, you saw that example on the billion and quarter. I wasn't consulted, nor was he consulted. Let's just spend the money.
Well, let's turn to that. I said I would. Let's turn to it now. It's INQ 000471 and this is the email exchange.
You see, even our permanent secretary was, his normally very calm demeanour was stirred by this.
There it is.
Paragraph 5.
It's point 5 there. I would like to understand why, when we have known for at least 3.5 months that testing is a vital plank in dealing with this disease, I was given less than 1 day to approve, you say, more than £1 billion transaction. It was 1.25 billion, wasn't it?
Yeah.
So what did you have to do in the circumstances?
Well, I fought my normal rearguard action, which I think in here over the page are various conditions that I applied or wanted to apply. I think I even said if you don't do these things, then you'll have to write a formal letter of direction to which then at least forces accountability and responsibility back to the people trying to spend the money in this extremely undisciplined way. And eventually, Alex Chisholm, who was we had a good relationship, and he was always calming, putting oil on troubled waters. He came up with a deal there which was hardly satisfactory, but given the pressure we were put under and the timescales, that's what we had to end up with.
All right, and I think at page 3 you make a similar remark about how ridiculous it was to ask for that approval.
Yeah. Well, what do you think? I mean, tell me. I mean, if you think I'm mad, tell me.
Not my role,
okay,
Lord Agnew, to provide that view. Let's turn.
But the country has to get angry about this sort of incompetence. That's the point, Mr. Wald, and that's why I get so upset about it. People think it's all being done in a marvellously organised way, and it's not. It certainly wasn't then.
Let's turn to another document. It's an excerpt from Chris Hall's second statement. It's INQ 000536 paragraph 28. There was a real need, it starts. Will acknowledged.
So we're in a very different context here now, aren't we? This is the early stages of trying to secure masks and things.
This is exemptions, exempting PPE from spending controls.
Oh, right.
Will acknowledge that there was a need to propose an alternative approach to Lord Agnew, Minister of State, and suggested either making PPE exempt from spending controls or providing a blanket approval subject to certain conditions. I endorsed the latter approach and requested that Will consult with Gareth Rhys-Williams, Chief Commercial Officer, before approaching Lord Agnew. Of those two, which do you think was preferable?
Well, I'd lost confidence in their ability to strike reasonable deals. So That's why I didn't agree with either of them. I think I was overruled in the end. I can't remember now, to be honest. But
all right, let's turn on, as I said I would, to the subject of private consultants. You clearly had concerns about the role and value of consultants in the government procurement effort. Is that right?
correct.
Yeah.
And it wasn't all bad. We had the people in the Ventilator team were good. PA Consulting, they were a good team, but it was a small team and it was very tightly managed.
You say that you were appalled at the costs of the consultants.
Yeah, I mean, again, just for context, the government was already addicted to consultants, as I put in my witness statement. Whitehall spent 1.8 billion on consultants before COVID. So this was an addiction. It wasn't a new addiction. It was simply building on the heroin addiction they already had. So it wasn't anything new, and it was something I could see very soon after I arrived was extremely bad practice.
That's 1.8 billion over which time frame?
I can't remember. I think it was the financial year before Gove. So Gove, it was maybe the financial year ending April 2019, something like that.
You say at your paragraph 33, I had limited interaction with them other than being appalled at the costs of consultants. I tried to reduce this, in particular with Deloitte and the call centre they established in the Department of Health for Baroness Harding, where they had over 15,000 employed with an FTE utilisation rate of less than 5%.
Yeah, let's just break that up quickly. So there weren't 15,000 consultants, but there were about 1,000 Deloitte consultants and about 100 of their partners. And between them, they cooked up a distributed call centre of around 15,000 people. So just so you understand it. But the idea that you needed a call centre of 15,000 people with a utilisation rate of 5% is beyond a joke. I mean, you understand what I mean by utilisation rate in a call centre? So that's the number, the amount of uptime.
Total billable hours over total hours available.
Exactly. Now, they were rightly concerned that you couldn't have the call centre overwhelmed because of the nature of this highly sensitive nature of trying to track and trace people. But 5% was a joke. And so that's why I tried to get the 15,000 reduced. I think we got it down to about 11,000 briefly, but as soon as my back was turned, it went back up again.
Lord Agnew, you were Procurement Minister, Minister for Spend Controls. You had a role within government on improving efficiency.
Correct.
What did you do about all of this?
Well, I think that when Baroness Harding had got the role as the test and trace czar, she had got herself an exemption from oversight of a lot of this by us. So I was irrelevant. So I would make a lot of noise because I felt so strongly about it. But ultimately, the levers of power did not exist, as you will, I'm sure, have heard the expression in government. You pull a lever and there's nothing connected, and that was an example.
You would say that because we've now encountered a number of examples where your attempts to improve matters failed. You would say that was entirely a feature of the circumstances that you faced, rather than your approach to it.
Well, you may think I was too blunt, too direct, too aggressive. Fair criticisms, I think. But these were problems that existed before COVID. I think it's important to understand that. And I think for most people who are interested in the machinery of government, there is a widespread recognition that the system is broken in many places. So, if I lacked the diplomatic skills to bring people on board, then that's a perfectly fair criticism. I'm not known for being a soft soaper.
I suppose the reason for the question, Lord Agnew, is that you identify within your written evidence, at paragraph 11, page 3, 2 interventions. In fact, you describe them as your only 2 significant interventions. One of them that you touched on a few moments ago, and that was encouraging Gareth Rhys-Williams, the government commercial officer, to lend up to 50 procurement staff to the Department of Health to help them accelerate procurement. And you made that suggestion in a meeting in the Cabinet office called by Michael Gove. on the first or second Sunday of March of 2020. Yes?
Correct.
And that was actioned.
It was actioned.
And it resulted in an improvement.
I think so. I hope.
Yeah.
I mean, and actually, as Gareth told me subsequently, that number was increased by a factor of 5-fold or even more. So yes, I think
I think you're right. We touched on those figures when Sir Gareth gave evidence to this inquiry. Then you identify a second significant intervention for which you were responsible. You said, I obtained funding from the Treasury to buy several mask manufacturing machines in an attempt to create some local manufacturing capacity. These were imported from China, but by the time we got them up and running, world supply chains had created a flow of masks that were much cheaper. The idea was to try to create some capacity for non-NHS needs.
Correct.
So that was a second significant intervention that was effective.
Well, not really, because the market adjusted, and so I mean, it was effective in what it set out to do, but the market caught up with us, and so the price of masks came down to a level that these relatively small machines could not compete with. So I don't want to make a big thing of this being a huge intervention, but I was very worried about places like schools, bus drivers, all these areas that weren't getting the masks initially, and all the priority was clearly going to the hospitals. But it wasn't a game changer.
So I come back to the reason for my question. We're 5 years on from many of these events now. There has been an opportunity for reflection and introspection. Everyone will remember the events of those 5 years ago. Very few were in a position as you were to be able to influence how the crisis was handled. Do you think, on reflection, that you might have contributed more than one or two significant interventions?
Well, I certainly saved quite a lot of money. I mean, that 150-odd billion I mentioned on the spend controls, there were a lot of savings if you aggregated them over the period of time. So I earned my keep in that area. But when I wrote that, I was talking more from a top-down perspective of what we spent £350 billion, give or take. We have left a huge debt legacy to our children's generation, who will have struggled to pay it off, given all their other problems. And the country has not recovered its productivity. We have damaged a whole generation of children. I see that from my work in schools, who were put wrongly into lockdowns, given all of that. So if I look across the wreckage of all of that, I'm pretty horrified. Tactically, yes, I was, you could say I was a platoon commander defending the perimeter of Dunkirk. It helped get those 200,000 soldiers off the beach. But it was a military disaster in its own right. So I think it's important that we calibrate where I'm putting myself here.
Lord Agnew, was one of your other interventions creating the VIP lane?
No, I'm not. I mean, I was pushing for clarity on what was happening, because we were forwarding these offers into the system. And certainly I said, can't we have some clarity about this? Because I was being chased by people. And then, again, every evening on the news, there'd be talks of such and such a hospital running out of gowns, or nursing homes with no masks. I mean, again, you have to remember the environment we were operating in.
You say in your statement that you were not responsible for creating the high priority lane or the VIP.
I don't think I was. I mean, I saw one of your papers. There was somebody, I think it was a civil servant, that suggested we have some sort of product. I mean, you have to have some sort of order, don't you?
Let's just have a look at what you say and what others say, and then I'll invite your view on that. Can we have INQ 000536345? It's paragraphs 16 to 17 at page 4. I've been asked to describe my understanding of how the idea for an establishment of the high priority lane came about. I've always been puzzled by this. The only role I played was to talk to potential suppliers who contacted either myself or Michael Gove to try to establish whether they were credible. If I thought they were, I would refer them to the government commercial team. And then at the paragraph below, you say, I did not have a role in the establishment, operation or supervision of the HPL other than referring credible sounding people to the CS commercial team. Could we now turn to the witness statement of Claire Gibbs, corporate witness statement from the Cabinet Office? It's INQ 000528389 at page 54, paragraph 3.82. Claire Gibbs tells us on the 24th of March 2020, Andy Wood, the PPE buy-sell leader, sent a readout of a virtual meeting with Lord Agnew, Minister of State at the Cabinet Office.
Well, what's wrong with that? I mean, a fast track.
Hang on. And the Treasury, which had taken place the previous day. Lord Agnew had asked if a fast track could be set up to process ministerial seniors' emails regarding offers of help that they were sending through.
Well, isn't that a logical thing to do?
Isn't that the VIP lane?
Well, I don't know. As I said in my affidavit, in my thing a minute ago, I've been puzzled by this. I mean, surely you'd have thought we were mad if there wasn't some prioritisation.
That's a separate point, Lord Agnew. It may be a logical thing to do. It may be a sensible thing to do. I'm just trying to establish whether it was your brainchild.
Well, if it was, then so be it. But we had to have some logic to it. I mean, I don't. If I'm the godparent of this thing, maternity nurse, so be it. I mean, you seem to have some sort of an obsession with this from just listening to your interrogation of other people. It was absolutely vital that we had some order. And if you look at, in fact, the papers that you've just provided when I got here earlier today, the percentage of contracts that went through this, well, you called it an HPL. I'm not quite sure which is which, but I presume it's the same. They were a smaller number of contracts for a larger sum of money, which made it viable. Yet you were advocating that in your interrogation of Gove the other day. So I'm frankly very confused at why people are in such a state about this.
You think it was a good idea?
We had no alternative.
Would you reinvent it, faced with similar circumstances?
Faced with the circumstances of being naked as a country with all these supplies, and that there were credible people contacting us with offers of help, yes, I would.
Let's just, to complete this, display INQ 000498337, page 2. This is the readout to which I've just referred, in which Andy Wood says this: another action I took, it's towards the bottom, was to advise Lord Agnew if we could fast-track ministerial seniors' emails regarding offers of help that we were sending through. We've developed a public pro forma, and so on. Is that consistent with what you remember?
I mean, I don't disagree what he's written, but I really struggle to understand why this is such a point of obsession. We really had nothing. And so if there were credible people out there who could help, then we should have gone with them. I mean, it was that simple. I think the mistakes with hindsight, as I put in my statement, where we kept using what are called single source, I can't remember the term now, but basically we should have retendered after the first initial crisis had passed, and there wasn't enough of that. So single sourcing, I think that went on too long. But I don't apologise for creating some order in the system if I was responsible for it. I mean, I think it's quite funny that suddenly, where I failed to bring any kind of impact everywhere else, I'm now considered the creator of this thing which has been so controversial. I do regret when we had this lawyer fellow, taking a case against us later that year. I regret that I didn't stand up and say all that then, but by then I was so embroiled in HMRC Brexit readiness, I was barely aware of what was going on.
You're referring to the Good Law project? Yeah,
I mean,
two cases, weren't there? There were two cases.
But I was so diverted by then, and that I wasn't, it was barely on my radar. So, but I do regret not standing up publicly to defend what we did.
And one of those cases...
I'm absolutely unapologetic. Yes, we got plenty of stuff wrong. Yes, probably some crooks came through the VIP lane. Yes, we've got this Baroness Moan woman who perhaps you're going to ask me about in a minute.
No, I'm not.
Well, that's a relief, good, because the NCA will deal with her. But I'm sure we got stuff wrong, Mr. Wald. But I mean, let me give you an example with this inquiry. The first witness statement I get, it's riddled with duplications. About a third of the questions I got were duplicates. And this is a machine with an unlimited budget moving at a glacial pace.
Lord Agnew, you've raised the Good Law Project litigation.
Just before you go on, can I interrupt? Just to, because of certain comments made in the press about the inquiry, Lord Agnew, when counsel for the inquiry asks questions, it doesn't indicate an obsession or it doesn't indicate a set view. It certainly doesn't indicate any view on my part. The questions are designed just to explore an area of public concern in some areas of the public, and also to give people like you a chance to answer, just as you are.
That's fair enough, Lady Hannah. I think, but I listened to Gareth when you were grilling him on this, and he carried out 2 inquiries with GI something or other, some commercial unit, taking what he described as the potentially most toxic cases. He took it very seriously when these concerns were raised. You didn't seem in any way reassured by what he said, but it sounded credible to me. But I mean, I wasn't involved in any of that by this stage. But I really do think this obsession with the high priority lane is misconceived, given the circumstances that we were faced with. I mean, I want to give you, I know I'm talking too much, but I want to put this analogy. In 1940, Lord Beaverbrook was made armaments minister. He got hold of the Castle Bromwich Spitfire factory, and from making no Spitfires, by the end of that year, they built 350 Spitfires. We lost 326 in the Battle of Britain, which was in around the same time. Now, in your world, you wouldn't have had a rogue like Lord Beaverbrook doing something like that. He was a philanderer, he was a bully, he was an egotist. But if he hadn't done what he'd done, we would possibly have lost that battle, which would have cleared the way for an invasion. Sometimes you have to have odd people in the system. And that's all we were trying to do, which is no doubt we'll come onto that with Sir James Dyson and the ventilators. You seem terribly upset about his role. The bloke is a genius.
Again, you're attributing comments or...
Well, I'm only listening, Lady Hallett, to what I've heard with, poor old Gove got grilled for 20 minutes on Dyson.
You did work at the Ministry of Justice, Lord Agnew. Basically, when counsel asks questions, it doesn't indicate any settled view on their part or any conclusions they've reached, and I repeat that I have reached. So please don't think that we have reached any conclusions.
But I want to try and reassure you, but I'm not being very successful, that there was not some conspiracy going on here. We were trying to react in real time to the biggest crisis in this country for 70-odd years. That is the reality of it. We got plenty wrong. And as I've said repeatedly in my statement, I feel overall that my contributions were pretty limited. Because look at the results, 350 billion quid, hundreds of thousands of children damaged by lockdown, productivity unrecovered. It's not a good outcome, is it?
Lord Agnew, I'm grateful for your comments on the VIP lane, not least because the contrast that they offer with those comments that have been provided by previous witnesses. I don't think a previous witness has said that it would be reinvented in that form. For one reason or another, previous witnesses have concluded that there were problems with it such that it should not be reinvented faced with a crisis of similar type. But you would say, yes, one would need to reinvent that system in those circumstances.
If we were as unprepared next time as we were last time.
All right, let me move on, and I do with some hesitation, because I suspect this is a topic that may result in a further increase of the blood pressure. It's excess PPE and waste, I'm afraid, which is another topic about which I know you feel very strongly. You express your view on the success or otherwise of PPE procurement at paragraph 45 of your statement. And if you say this, if one steps back from the fray and sees the colossal amounts spent on PPE, much of which is now being burnt, one can hardly regard it as a success.
Correct.
Now, am I right that this topic also fell within the various remits that you held as minister within the relevant period?
Well, I think when I got word of it, it just wound me up so much that I had to use whatever influence I had to try to do something about it. The honest answer is I can't remember. I think at one stage maybe somebody asked me to deal with all of the chaos in the docks because, as I mentioned, Felixstowe dock at one stage had 10,000 PPE containers piling up inside it. And
yes, you say so at paragraph 96 of your statement.
Yeah.
You say disposal of surplus PPE was one of the most upsetting parts of the whole procurement journey. There was vast over-ordering. At one point, it almost blocked Felixstowe docks. Penalty rates were being paid on seaborne containers that were kept because there was no storage facilities. Warehouses were rented eventually, but then began the destruction of PPE. And I know that Mr. Maron, at the beginning of his evidence, was taken to the scale of waste. It was an enormous scale of waste. I don't think I need to go back to the figures, but he agreed that in July, the end of July of 2021, there were 6.9 billion items of surplus PPE. That was a figure that reduced down to 4.9 billion by 2023, but it continued to cost £120 million a year to store excess PPE, and £3.8 billion worth of stock expired before it could be used. So these are enormous sums.
yeah, very upsetting. But again, I'm conscious of not talking too much. All I would say to you, the lesson to be learned, and I just hope that you put this front and centre when you do put your report in, is if there had been inventory management in the hospitals, this need never have happened. And inventory management is not complicated. Every chain of clothing stores in the country uses it. I would use the example of Next. If Lady Hallett goes into Next in Croydon to buy a dress and they don't have the colour she wants, they will say, we've got your colour in your size in Oxford Street. You can go there, or if you wait 2 days and come back again, we will have it brought to the store in Croydon. That is all inventory management is. It is that simple. And that is what there should be in every one of the 1,200 hospitals. And if that had happened, one at the beginning, if they'd had that, which why on earth does one of the most allegedly advanced economies in the world not have that embedded into its health system, is beyond my comprehension. But that should be the lesson we learn. Has anything happened in the 5 years since the COVID? I bet it hasn't.
All right. Lord Agnew, you anticipated that I would ask you about Dyson.
Indeed.
Sorry, just before you go on, are there any other ways, Lord Agnew, which you think the excess, the waste, could have been avoided? I mean, the team that were trying to get PPE were under huge pressure. You know, at that stage, they had no idea how many more waves there were going to be, what the burn rate would be. And as you say, they didn't have an inventory management system. Are there any other things that you think could have been put in place to prevent the excess buying and the waste?
Well, when I got involved, I did try very hard because COVID was still a worldwide issue, and there were lots of countries, particularly Commonwealth countries, that needed equipment and support. And so I tried to use that, but I just got lost in the quagmire of the Foreign Office, DFID, Health Department. All these people, they wouldn't work together as a team and even donate this stuff to... But
that's distributing the excess.
Exactly.
My question really was, is there anything else that could have been done, do you think, to prevent that excess arising? Or was it inevitable, given the circumstances that the teams faced? Were there any other ways of controlling expenditure or reducing...
Well, that was with hindsight, I think we had the success of the vaccine, which did rather kill the disease. So We didn't know that, so we over-ordered, but it was an over-ordering of an order of magnitude far greater than needed to be, because we didn't have proper data to show, as I mentioned earlier, to show the journey from, I got the COVID. I didn't know I had it until 3 months later. I was very lucky. I only got a very mild burst of it. So we didn't know about the level of severity it would hit different people. So I would urge you to focus on inventory management, actually.
Yep. Thank you.
Thank you, Malid. If I can just supplement that question with one further that arises out of it. Do you say that given problems with inventory management, the scale of the overordering was inevitable or was nonetheless excessive? There are witnesses that have said they would rather be sitting where you sit and explaining overordering than underordering.
Yeah, and I agree with that. It was a lot of the stuff around the sides of it, though, Mr. Ball. So this whole storage issue was such a catastrophe. So we were paying huge surcharges on sea-going containers because they hadn't organised proper storage facilities. So I mean, to give you an idea, a sea-going container costs about, I don't know, 4 or 5 times a day what an ordinary one that just sits in a static. They hadn't got any of that organised. I said to them, harness the farming community. I said, as a farmer myself, we've got huge sheds all around the country. And if you're in, say, the onion business, they have to be temperature controlled, humidity controlled. There were all sorts of opportunities. I couldn't get anyone to take any notice of me.
But what I'm keen to understand in relation to this is whether the scale of overordering, the scale of waste, the eventual £3.8 billion worth of stock expired, unusable at the end, is the, in your view, inevitable consequence of inventory management problems, or is excessive, even taking into account inventory management problems?
I think it's excessive. I mean, I accept that we should have been on the side of caution and ordered a bit more than we thought we needed. But my frustration is that we hadn't a clue what we had when we were ordering more.
Which seems to suggest that it's almost random how much you end up with if you simply don't know what you've got, or when the vaccine might be rolled out, or when other imponderables might eventuate, then you just keep ordering. Is that the position?
Well, that's what seemed to happen, yeah.
All right. My lady, I was going to turn to the topic, another topic. I don't know whether you're minded to take an early break.
I wasn't, unless you want me to.
Okay, then I'll keep going. Let's start off with what you say about ventilator procurement. We'll go back to your... I'll just read from your statement, if I may, at page 3, paragraph 12. You say, I played a bigger role here as I volunteered to be the minister overseeing efforts to manufacture them in the UK. Michael Gove appointed me to this oversight role in March 2020, just after a competition had been announced for UK suppliers to come forward with designs and plans. Yeah?
Correct.
So we then... we know from the witness evidence of Mr. Dan Webster that you were the primary Cabinet Office Minister involved in the ventilator challenge and that you made all relevant ministerial decisions, yes?
Yeah.
You were involved in daily meetings with Gareth Rhys-Williams and others in the ventilator challenge from the 22nd of March 2020 until the 20th of April of the same year, when the frequency of those meetings was reduced.
Yeah, we met 6 nights a week, including a Sunday. And importantly, given your concerns about Dyson and everything else, the MHRA were there, I think, virtually every evening. It was a truly collaborative effort.
We heard from Sir Gareth about the technical design authority within the Ventilator Challenge programme. It was the mechanism, was it not, by which it was possible to assess the progress of designs against the specifications that the MHRA insisted on, and more specifically, whether a design was likely to meet the technical specification and medical need.
Correct.
And it included senior representatives from the MHRA, as did your meetings, senior clinicians, and the Medical Devices Testing and Evaluation Centre. We know from Mr. Webster that the Technical Design Authority made recommendations which were then considered by yourself who would decide which projects to continue and which to stop. The purpose of the technical design authority was to make recommendations, i.e. to yourself, who was the ultimate decision maker, about what to stop and what to continue, based principally on the assessment of likely medical utility.
Correct.
And then finally, Mr. Webster says that the primary criterion for the selection of designs in the ventilator challenge was clinical efficacy.
Correct.
Which has its own meaning in the context of a ventilator.
Well, I took a lot of advice on this stuff because I didn't even know what a ventilator looked like when I started. So my job really was to provide leadership and momentum and clarity of mission, and to support all of the people involved to give them the empowerment that they needed to get on with it as fast as possible.
So could we have INQ 000512-992? And we'll start at the bottom and work our way up, I think.
Can you expand it a bit?
Yes.
Oh, sorry.
Can you read that?
No. That's better.
There we are.
Thank you.
If we could start with Sir Gareth's email and then look at your response. Dear Lord Agnew, apologies for the lack of a formal sub. Anyway, the second paragraph, he says that what had come to his attention was a reduction in the demand for ventilators. You may remember this.
What was the date of this one? 10th of April, right?
10th of April. Until Wednesday evening, you were encouraging us to make as much as possible, recognising that many of the 40,000 firm orders plus the LOIs were not going to actually be achievable due to product or manufacturing failure, etc. But we now recommend that we throttle back considerably. Do you remember that?
I mean, I don't remember the chronology of events, but I do remember this. And as I say, it's back to my obsession with oxygen supplies as well. I think maybe there was a dawning realisation that we simply couldn't, the system could never plug in anything like this number of ventilators. Well,
there was a dawning realisation here that the number of irons in the fire was too great.
Right, yeah.
And in fact, Sir Gareth, towards the end of this email, he says, the implication is that we should kill off a number of different options. Remora, we should kill off Helix, we should allow those products going to the test house this weekend to continue. The list of likely candidates to be struck off are Oxvent, Florence, Dyson, Mosquito, Jarhead, Apollo 13, in that order. So Dyson is third in the list. Early next week, and then just towards the end of this email, we can finish on there. No, a bit further down, please. There we are. The key decisions we will need from you and other ministers are whether we feel that 18,000 and 30,000 targets are appropriate. If you want us to manufacture for use, for export or differed use, we can then trim the previous volume asked to match. I hope this makes sense. And he says before that, I appreciate this is quite a lot to take in, so I wanted to flag this with you as soon as possible so we could discuss on Monday. Presumably, Sir Gareth there he recognises that this email contains quite a significant change of gear, or a recommendation for that. Yeah.
And what did I say?
Well, let's see what you said. If we go to the top of this email. Gareth, many thanks for your note. I pretty much agree with all of it. By killing off the no-hope designs, you free up resource to really concentrate on getting the viable ones through regulatory testing and onto the battlefield. Couple of points. Very keen to try and salvage. The key one is C. We're going to have to handle Dyson carefully. I accept that contractually we can walk away as he hasn't delivered by the due date. Do you remember that? He didn't deliver by the due date?
Well, I don't think anybody had, but I mean, I don't disagree with it. It's a statement of fact. I don't remember the micro, the micro series of events.
I also accept that we have an indemnity battle ahead. Do you remember what you meant by that?
Well, this was a problem actually with all of them, I think, which is why even at the end we kept several in play, because a couple of them hardballed us on on indemnity, basically said, we want a blanket indemnity from the government if our machines kill anybody. We're not on the hook, and that was something that worried me very much.
Okay, but you seem to give Dyson's design special treatment here. You say, but just killing off his design, assuming it gets through MHRA, won't be an option. I suspect we'll have to buy a few machines, get them into hospitals so that he can then market internationally, being able to say that they are being used in UK hospitals.
Assuming it gets through the MHRA, by the way.
You make that very clear.
I mean, I know you got an estate about this in an earlier...
Don't worry about Mr. Gove's evidence.
Well, only that clearly you were worried that another one of these heinous plots... That
Lord Agnew, you make as plain as a pikestaff that this is contingent on MHRA approval.
Good, okay.
It's there for everyone to see.
I don't want the narrative going off into the... I'm a Bond villain.
That was last week's evidence. Right, we're focused on
machines
this.
Out there.
I suspect you say we'll have to buy a few machines, get them into hospitals, so that he can then market internationally, being able to say that they're being used in UK hospitals.
Yeah. Well, at that stage, I assumed he would produce something that worked. I mean, he threw a hell of a lot of money at this, as you will know. And he was sending us daily updates. He used to call them night letters, where he had teams in Singapore, I think, and also in his Malmesbury factory. He was throwing a level of R&D at it that dwarfed anybody else. So I think it's important to remember that. I know you think he's been given some favoritism here. Maybe that we have, but the rate of which he was pushing his own development gave me that reassurance.
If he were able to produce a ventilator that worked, why would you only be showcasing it in a few UK hospitals in order that it could be exported abroad?
Well, I was looking for a way to save face with him if he produced a viable product, but we're also conscious that the design advice that Gareth put up in his note was that he felt that there would be better models than that. But again, at that stage, we really didn't know. We didn't know what the rate of manufacturing capacity was of these people, and nor did we know about this indemnity issue, which I mentioned a few moments ago. So I don't think it was a mistake to keep Dyson in play until we got to the point at which we knew his machines couldn't work.
It was your job to let Sir James Dyson know that, to share the
hardest
bad
phone
news.
call I've ever had to make in my professional life.
Hardest phone call you've ever had to make in your professional life?
Yeah.
Why was that?
Because this was a bloke who was rung up by the Prime Minister and said, we've got a real problem here. We know that you're one of the most successful manufacturing entrepreneurs in this country. Please help us. He took up the flag and he threw everything at it. And he made an enormous amount of effort over those preceding few weeks or maybe months. And so when the day came that it didn't work, or it didn't, MRHA said, sorry, this isn't a goer. I was in charge of this thing. I was the one who'd ring him and tell him. And this is a man who's not used to failing. I mean, how many people do you know in this country who've made £20 billion from a standing start? You don't get to that level of success by tolerating failure. So it was a very difficult call. And luckily, we both have a Norfolk connection, and I was able to build on that connection, and I was able to deliver the news to him, I hope, in a civilised way, and to recognise the huge commitment. I mean, they say he spent 20 million quid of his own money. How many other people did that during COVID for this country?
Lord Agnew, we have dealt with some lessons learned through the course of your oral evidence. I wanted to, and you deal with the lack of lessons learned within your written evidence. Your own view is that lessons have not been learned, isn't it?
Correct.
Are we moving on to lessons learned?
Yes.
In which case, I think we will take the break now, Mr.
I don't think there's anything that remains because...
Sorry.
It may be that is there anything you wish to add in terms of the lack of lessons learned or lessons that should be learned beyond that which you have said in your oral evidence?
No, I mean, we've talked about the inventory management on these consultants. I did achieve the creation of an internal government consultancy service, which was starting to reduce the dependency on external consultants, but that was abolished after I left. So this is the problem. I mean, if you look at Kate Bingham, I'm sure you'll have her in here at some point, if you haven't already, on the vaccines.
Already been in.
I'm sure she's done YouTube lectures on it, how the machine just reverted to type within weeks of her leaving. All that wonderful leadership and energy she brought, the DNA doesn't take into the system. This is the bit I just don't understand. They don't see the lessons and say, that's how we'll do it from now on. It's always revert back to the same plodding mediocrity.
And if you went back into that role in
God
similar
help.
circumstances, excuse me?
God help me that I would ever do that.
Is there anything that you would do differently?
No, because unless I had the absolute backing of a Prime Minister that I could do things that would make your hair curl, I wouldn't do it.
Lord Agnew, thank you. Those are all my questions.
Thank you. So what happens? Sorry.
Sorry, well, basically, we could either take a break or we could move to Ms Morris's questions. You've got about 20 minutes, Ms Morris, is that right? Are you happy to carry on?
Yeah.
Or would you rather we took a break?
I mean, as long as you're happy, let's carry on.
Yep, right. Thank you. Ms Morris.
Thank you, my lady. Lord Agnew, I ask questions on behalf of the COVID bereaved Families for Justice UK.
You're going to have to speak up a little bit. I'm slightly deaf.
So I represent over 7,000 bereaved people who lost their loved ones during the COVID pandemic. And it's a UK-wide group that represents probably just one section of the public that does have concerns about the existence of the VIP lane. And so I will be asking you some more questions about it, whether that makes me obsessed or otherwise. I hope you'll understand it's an important area that the COVID bereaved would like some answers to. You've said today that you don't understand sort of public concern about the VIP lane. I'm going to ask you to look at, please, a section from Sir Christopher Wormold's statement, and that's INQ 000571763 at paragraph 43, please.
Can you expand it? Thanks.
I'm very grateful. It says here, I became aware of a high priority referral route when others referred to it, but I was not involved in concluding that such a route was needed, nor do I remember being asked whether it should be created. My view is that the principle of triaging referrals and giving priority to the most promising was correct. The problems that arose were in how the prioritisation took place, with too great an emphasis placed on who made the referral, as opposed to the nature and promise of the lead. The criteria used to assess the proposal was the same for all matters of referral. The problem was not with the differing standards of assessment, but with who got to the front of the queue. And as a result, some less promising leads were given too great a priority. Do you accept that view, Lord Agnew?
No, I mean, that's a perfectly reasonable statement, and I'm not going to disagree with it. But again, I just want to go back to where we were as a country at the early stages. I want to reassure the people you represent. No, we didn't have any mask manufacturing capacity in this country. We had one factory, which was the 3M factory, but they're an American-owned factory, and the American government could have deployed what they call the Defense Act, which requires any American-owned corporation anywhere in the world to send their production back to America. We had nothing. So you must get that through to your
So your
people.
point, as you said to the chair, is that because of how poorly prepared we were, there was no other choice.
Yes,
Okay.
exactly. I mean, yeah,
Right.
with hindsight, of course, there's wonderful things you could have done, but we didn't have hindsight.
I understand that.
And I want to reassure your people that you act for, there was no heinous plan to enrich a few of our mates. It is such bollocks, if you forgive my language. You know, we were in the most terrible position. And this was the credible people who came forward mostly. There was no doubt one or two crooks and cranks, but they were largely credible, and it's borne out in the volume of stuff that they ended up delivering. Well, so I just want you to get that through to your people. This was not some kind of plan right-wing people trying to enrich themselves.
Well, it'll be the chair to make those decisions and to forgive any language that's used in her courtroom.
I apologise. But it's important because they've been whipped up, your people, by a narrative which has not been properly countered. And that's why I feel so strongly about this. And I blame myself at time, as I said to Mr. Wald, when this court case was brought, I was too distracted to not stand up then and make more noise about it.
And you'll understand that the questions that I put are on behalf of individual people, members of the public, and those who've lost their loved ones. So if we can just focus on the questions that I ask rather than comments on how they may or may not feel about it.
No, but the point is, this was done to save those people.
I understand the evidence, thank you. You note at your paragraph 68 of the statement you've provided to the inquiry that the counter-fraud function of the Cabinet Office was not properly utilised, in your view, by the Department of Health and Social Care. So did that include in the PPE buy-sell? Is this an area where you think the counter-fraud function should have been more looking for those crooks and cranks, as you say?
Well, I can't speak with any specific knowledge because, as I say, they operated their kind of walled approach to us. But
Okay.
and I'm not familiar with how much fraud there was in procurement at the end of it. So because that would have taken a while to manifest itself. But I don't think that they were, given the volume of transactions, they should have lent on us more heavily.
And how could they have helped in preventing fraud in the procurement?
Well, because we had people in the centre, in the Cabinet Office, who were real international experts. I mean, the second most senior person in our counter-fraud team in the Cabinet Office was actually, we sold a day a week of his time to the Australian government. He was that highly regarded. So there was real expertise there, and I don't think it was used enough. But I can't give you specific examples.
Thank you. Moving on now to my final topic, please. The Good Law Project identified that Uniserve Limited, a logistics company, was awarded contracts for both logistics and for PPE valued at over £800 million in the early stages of the pandemic. Their contracts were worth over £300 million alone. However, it's publicly available that 182 million items that were supplied by the company, valued at 178 million, were deemed unusable by the NHS. You've been identified by the DHSC as the high priority lane source of referral for Uniserve's offer to supply PPE. Was Ian Liddell, the Uniserve director, somebody that you knew personally or through political connections or otherwise?
No. I mean, I don't even know what Uniserve is. What is it? What is it?
Were you aware that they had no track record in the supply of PPE?
No, but we used a lot of people who didn't because we had to go wherever we could. But I had no relationship with them.
Okay, so if that's correct, on what basis did you consider their offers merited urgent or priority consideration within the VIP line?
I can't remember.
Thank you. Thank you, my lady. Those are my questions.
Thank you very much indeed, Ms Morris. That completes the questions we have for you, Lord Agnew. I hope we haven't opened too many wounds. I can tell there are very high levels of passion in some of your responses, but I promise you we are investigating everything thoroughly. We're trying to give people the opportunity to answer the questions that have caused people concern. So thank you for the help that you've given to the inquiry.
Thank you.
Very well. 10 o'clock tomorrow. Is that right?
All rise.